Hi friends, welcome back to EduHub Abhilasha. Thank you for your constant support on my previous videos. And friends, in this video, I'll be covering all the important topics subject-wise for the upcoming Fmge exam. Friends, actually one of my subscriber also had requested for the same. So I thought to create this video in three parts. In first part, I'll be including first and second year subjects. In second part, I will be including fourth year subjects. And in final part, I will include the final year subject so that it doesn't get jumbled up. Video is also not too long and you get the content point wise, right? Last minute revision topics which I thought it's important. I'm telling you, right? So, friends, beginning with first year subjects, anatomy, you have to be thorough with the skull, foramen, and contents like foramen rotundum, foramen spinosum, foramen ovale, everything because these are very important. Then you may see the peripheral nerve lesions and injury to plexus like brachial plexus, what upper trunk injury, Erb's paralysis, lower trunk lung cleats. These all you have to know. Then bones, you have to see the image and you have to uh, tell the attachments and all in just brief time. Don't give much time because in this year NEET PG the question was asked given was bone pick, so you have to identify it. It was incus pick, so like that you have to know and keep seeing it again and again. Then you have to know cubital fossa and popliteal fossa contents. Then you have to be thorough with the triangle of neck, anterior posterior triangle and its boundaries and contents. Then you have to be thorough with anatomical snuff box and its contents, very important. Then palmar arches, superficial and deep palmar arch, you have to be thorough about. Then inguinal canal and its contents, you have to know the boundary, including everything is important. Then femoral triangle and femoral triangle boundaries and contents, everything you have to know. Then there is a triangle and quadrilateral friends here formed by trapezius muscles and other muscles bounding it. So, friends, you have to know the triangle and quadrilateral formed at back side. And friends, then you have to know perineal muscles and nerve supply, right? Because it is very important and which muscles are cut during episiotomy. So you have to know it because it is asked in gynae part also and in anatomy also. Perineal muscles, everything you have to be thorough about. Then contents of spermatic cord, then internal iliac artery branches you have to be thorough about. Then portal vein and portal circulation, right? Then aegis and hemiaegis vein drainage you have to know. Then root of lung contents you have to be thorough about. Then arterial supply of heart, right? You have to be thorough about. Then stomach bed arterial supply, you that celiac trunk arises arising all the arteries nearby, you have to be thorough about. And one more you can see, liver relations anterior and posterior, right? You have to these be thorough with these topics in anatomy, right? So friends, in biochemistry now I'll be telling what all you must know. Glycolysis and electron transport chain, in since 11th and 12th class you have been reading about it and it's very important, and you have to know the energy derivatives and all the enzymes in the process, and everything must be known. Aerobic, anaerobic glycolysis, ATP yielding, everything must be known. Krebs cycle, you also should know glycolysis and Krebs cycles, that PDH complex, everything. then reversible, irreversible glycolysis, everything you must know these, because these are must know topics and you can't mess up with this. Then amino acid and fatty acid metabolism, you just see, don't give much time, and also see amino acids, essential and non-essential amino acids. Then glycogen storage and lysosomal storage disorders, these are burning topic these days. Don't miss it, revise it again and again, because these are very volatile and you must remember it. Then molecular biology, all that translation, transcription, everything concept is must know, central dogma. These days, CRISPR-Cas9 is being asked, and it should be known. Read about it, and I will also try to create a video on it. Then vitamins and enzymes. Vitamins you have been reading since childhood. You have to revise it again and again. The deficiency disorders, then sources of vitamins, what all are, then everything, it should be on tips, right? Then enzymes, Km and Vmax relationship, what all happens. So it should be on tips. These are the important topics, because if these you do, I don't think you will mess up with any questions in biochemistry, right? So these were for biochemistry. So beginning with physiology, the important topics is you have to be thorough with nerve conduction and how impulses are transmitted. Then association areas in brain, that primary association areas, what is the number, Brodmann area, everything you have to know about it. Then blood, you have to be thorough with the coagulation cascade, everything, disorders, so, right? Which deficiency, which factor deficiency leads to what and how. Everything in basic you must know, so that if your question is asked, you can relate with it easily. Then GI secretions and related physiology, you must be thorough with. Then upper motor neuron and lower motor neuron pathway and tracts, that is spinothalamic tracts, corticospinal tracts, you must be thorough with it. Then pain fibers, uh, touch fibers, everything you must be thorough with it. Because CNS is one of the important point in physiology, and rest all also are important. Don't give much time, just revise this so that it will be done and dusted. So, beginning with the topics important in pharmacology, I'm just getting you through the basic headlines through which questions come most of the times. So, revise the topics like that thoroughly, because these four are must to do in pharma. General pharma constitutes 70 to 80% of questions, right? And these are must to do in pharmacology, right? And those graph like potency, efficiency, efficacy, all that you have to know, and how to differentiate between them. It's a fixed question, friends. You must know, and you can't mess up with these things. Then CNS, ANS drugs all are very important, and these are must read. Then these days immunomodulators are being asked many times, so you must be thorough with it. Then you must read anti-TB drugs. You know that TB is a burning topics, age old, so you can't mess up with that. Then after that, if you have more time, then you can read this. These include antimicrobial, antimalarial, antifungal, kalachar, everything. Otherwise, if you do these, you will answer most of the questions. So friends, basically you have also to be smart enough in answering questions, right? And in preparing, so that less time you have to do much efficiency, right? you don't have to be like give more time and gain less result. You have to give less time and gain more results. So in this way your pharma will also be done. So, in microbiology, these are the four important topics, four, five important topics which you must get to know at this last moment, right? Bacteriology, you have to know about the organisms, right? Gram positive, gram negative, and several other. Then, mycology, you have to know about the fungal organisms like all the sporotrichosis, chromoblastomycosis, and the images regarding these are very important, like Madura foot, and all these things are very important. Then, stains, you must know the procedure, everything. Then complement system you must know. Then in uh, others you can do the general microbiology, like you have to know about the various medium. Just go through this once. In general microbiome you have to know about the microscopy. And microscopy basically just follow light microscope, see the parts of light microscope. Then electron microscope images you have to get to know. Just normally they are black and white, so you must know that these electron microscope images are black and white, right? And in these you have to know about the media, right? And several culture. Then if you have to know more, then you can go to know about the eggs, specifically a few organisms you have to know, because everything you can't remember, but you can know about few organisms, right? Like H nana, encyclostoma duodenale, everything you can't see, like Diphyllobothrium latum. These are the things which you know. So eggs of organisms, like H. nana, Diphyllobothrium latum, Encyclostoma duodenale, right? So these were about microbiology, right? So in pathology, you have to know about general path. Then blood, the slides, you have to see the images of various anemia and hemat disorders. Then genetics, you have to know about the genetic disorder, pedigree analysis, autosomal dominant recessive, X-linked dominant recessive, all those disorders you have to remember. And you have to know about cross images of CVS. And then if you are done with these five, then you can go to other systems, right? So this was for path, and you can follow the your rapid revision guide for this, right? So I hope this video was useful to you. Do share, and please subscribe my channel and hit a like.